Hi mga Arthritis Warriors, I'm Dr. Jonathan Flordelis, continuing our question and answer portion on the top 10 questions about knee arthritis. So our next question is, Doc Joff, am I too old for a knee replacement surgery? Actually, it's not age that decides surgery. It's actually your medical condition, how strong you are, and of course, how bad pain is. I've had patients who are post-stroke, post-MI, who've had the knee replacement successfully because they've been medically cleared by their doctors, and this man is now walking back to life, having both knees done, one after the other. Remember, your health matters, your pain and suffering, if it is severe and is already hindering your quality of life, dili na ka makadto sa mall with your friends and family, you cannot walk far, traveling is a bother, you cannot enjoy life. So a lot of patients want their independence, some of them still want to work, and di sila ganahan staying at home and doing nothing. They have work, they have businesses, and their mental health and their physical health is very important. Having a severe arthritis that is bothering them every day, it gets them down. So the knee replacement is a solution, and it's not their age that matters. It is actually their health and fitness and also their pain. Remember, modern surgical techniques are actually allowing our patients to walk same day as surgery. Even abroad, knee replacement surgery is now being done as an outpatient basis. So we are now doing patients on knee replacement and having them walk right away and discharged sometimes day one after surgery. Again, not every patient is the same, so always consult a doctor. And remember, if you think you're too old for a knee replacement, I've had knee replacement patients 90, and there have been knee fracture patients who are walking back to life at 100 years old. There is a difference between the age in your birth certificate, your chronologic age, and the strength of your body, your physiology. That is called physiologic age. So much love and respect, mga Arthritis Warriors. Age can be just a number, but remember, your life is also a priority. You want to enjoy your life and maintain a long and strong life, moving better, moving stronger. Hope that helps, mga Arthritis Warriors. And if you know someone who is 70, 80, 90 years old with severe arthritis, comment below and let me answer questions about age and the strength. And also, every patient, safety is first. That's why we have them undergo a medical clearance before any surgery. Remember, safety first, mga Arthritis Warriors. And we're here again answering the top 10 questions for knee arthritis from different patients. And I'm Dr. Jonathan Flordelis, your Cebuano hip and knee specialist. You can call me Dr. Joff, and we're inviting people to join our Facebook group. It's free to join, Hip and Knee Arthritis Cebu Facebook group. And if you're interested in knee replacement, join the group. We have a free guide which we are giving to patients who are interested in knee replacement. Moving forward, the next question is, Doc Joff, how painful is knee replacement surgery? The fear is one of the things that keeps people trapped in years of pain. Hadlok sila, sakit kuno kaayo. And like I mentioned earlier, patients are walking same day as surgery. Not every patient is the same. Our techniques for pain relief have evolved. Modern anesthesia techniques improves pain relief. During surgery, you don't feel anything. And after surgery, we continue giving pain relief so that you can walk right away. Pain steadily improves with movement and physical therapy and rehabilitation. Most patients, like the patients I had like a week ago when I did bilateral knee replacement, she was walking day 2 after surgery because on day 1 she was still afraid. But when she realized na wa na di ay sakit, yes, she was walking back to life and realizing na, uy, dili naman di ay sakit. The pain of arthritis is definitely not the same. It's definitely worse than the pain of surgery. And after surgery, we keep on monitoring our patients because we want them happy. And that's what I call walking back to life, because patients are walking immediately after surgery. Most patients will tell me that their surgery pain is definitely less, and they tell me na, Doc, sayang, dapat gipa operahan na ninako sa una pa, kadtong barato pa. Anyway, the pain fades and the function returns, mga arthritis warriors. I hope this helps. And right now, why are we answering these questions? Because we're here to educate and we're here to inspire. And hopefully, if you have questions about knee arthritis, knee injections, or knee replacement surgery, comment below and we'll try to get back to you as soon as possible. And we're going to continue, mga arthritis warriors. Remember, we have a free guide that you can get. Just join our Facebook group for free. It's the Hip and Knee Arthritis Cebu Facebook group. Next question, question number 8. Doc JOF, how long is the recovery after a knee replacement? Patients actually overestimate the recovery and underestimate how fast you can return to your daily function. Walking can actually start hours after knee replacement, and I've seen it many times in my patient. Hours after surgery, they are able to walk, and the progress happens week by week. The swelling goes down, the redness, the inflammation, it subsides generally in a few weeks. Not every patient, of course, is the same. Walking immediately, daily activities, usually they can resume within about 6 to 8 weeks. Less swelling and less soreness. There's definitely some soreness. That's why we keep on giving medication. Rehab is also a very big factor that affects patients. Because remember, knee replacement is like changing a car tire. Change tire sa auto, but we also need rehab and physical therapy for the engine. A stronger engine, the faster a car can run. Recovery and knee replacement is not something a patient does alone. We have a team. We are a team. We team up with the patient. We team up with rehab doctors and internists to make sure it's safe, to make sure we are planning for your success. So I hope this helps, mga arthritis warriors. We're going to question number 9. How long does a knee replacement last? Modern implants. This is an interesting question. So this is a question that patients are afraid of because it's actually the investment that they don't understand. They worry about durability. They are afraid na dili mo last. Actually, this is an investment because it lasts for a very long time. Some will have 20 or 30 years that the knee replacement is still going strong. Of course, the weight of the patient, the activity level, and the alignment matters. So not every patient is the same, but we've had many patients, thousands of patients, because this is one of the most successful surgeries after the total hip replacement. The knee replacement is very successful. 98% of patients are happy, and the implants are meant to last 20 or 30 years. Now, I'm not 20 or 30 years into my practice, but definitely there have been patients 10 years who are very happy with their knee replacement. Revision surgery, kung naay mahitabo, is uncommon, but definitely there is a 2% chance of risk of revision. That is why I will not say 100% to any of my patients. The decision is based on this investment that you can have decades of pain relief, not just a few weeks or days. Not like the injections or the pain relievers that can last for a very short time only. Hope this helps, mga arthritis warriors. Again, I'm Dr. JOF Flordelis, Cebuano Hip and Knee Specialist at the Cebu Orthopaedic Institute. We're here to educate and inspire. If you have questions about knee arthritis, knee injury, comment below. Join our Facebook group for free, where you can actually get in touch with different arthritis warriors like yourselves and share your story. You can also get our free guide. Again, join the Facebook group for free. That is Hip and Knee Arthritis Cebu Facebook group. So we're also answering any questions. So comment below if you have questions about knee arthritis. We can put it in the next question and answer portion. Last but not least, Dr. JOF, what happens if I delay my knee replacement too long? And remember, the knee does not suffer alone. It is a chain. The knee is connected to the hip, the back. That's why the other joints and other parts of the body will pay the price. It's usually the joint above, the hip joint, and the joint below, the ankle joint that suffers. For my last patient, she was already picky or kimpi. So her legs are knock-kneed from straight, anak na sila, and she was feeling very swollen and pain in both of her ankles. Her limp was also severe. She needed 2 canes, one on each hand, to be able to walk. And her walk was not very strong, only a few meters. She had severe muscle wasting and muscle weakness. That's why for me, early surgery means a faster recovery because you have a stronger muscle base and you lose a lot of muscle with more arthritis. Remember that movement is medicine, and the less movement you have, the weaker you become. Delaying actually the knee replacement can also delay your healing. So again, I hope this helps mga arthritis warriors. I'm Dr. JOF Flordelis, here to educate and inspire you. Those are the top 10 questions about knee arthritis this year. And hopefully we can continue this in the future. Please like, follow, and share this with your friends who are thinking that they have knee arthritis, knee injury, or thinking about knee surgery. Hope this helps. Bye-bye.